Thank you for inviting me to speak at the webinar today. My name's Dr. Helen White and I'm Subject Group Head at Leeds Beckett University. My remit was to talk about student training during COVID, some of the challenges that we've had as a university and the new ways of working that we've had to implement in order to see our students through to graduation. Decisions were made for our buildings to close very quickly and overnight on March the 18th, 2020, the university closed all buildings to staff. Our challenges felt really huge at the time, but really when we sat down and considered it as a team, then it really fell into four main areas. That was the fact that we needed to revise our teaching, we needed to revise assessment, to revise placements, and also really ensure that our students got through to graduation, especially for those who had secured posts already. To do that, well, we had a very good team behind us. So you'll see here that we work very closely as a group. We have 6 nutritionists, we have 9 dietitians altogether. And so it was really important that we worked as a team, that we quickly established online working together as a team, and that we tackled systematically some of the issues that we needed to very quickly. Teaching became our main priority and we transferred to online delivery in April 2020 using Microsoft Teams, which we hadn't been familiar with before, PowerPoint with video, Blackboard interactive discussion fora and interactive online seminars and tutorials. And we complemented that with personal tutorials for our students to understand, what their difficulties were and whether they were parents, carers, having to homeschool their children, and all of the other areas that are now familiar to us in terms of challenges that might present. We then looked systematically at the revision of assessment across every single module within every course. The team worked to review changes to exam formats, revise exam content, to adapt to online assessment, accredit previous learning, so where we couldn't perform OSCEs or very practical assessments, how would we do that in another way? And we used the formative assessments that we'd undertaken with those students. But we had to learn new systems. How did we deliver multiple choice exams in someone's home? How could they all access and have security of being able to access? And how would we prepare the students for that? So, the test runs, if you like, to understand that they could all access the systems and submit on the day. And we checked with the HCPC and the Association for Nutrition to ensure that they considered what we did was sufficiently rigorous and that there would be no challenges in the future from them and that we had fulfilled what we needed to. For placements, which was perhaps one of our most complex areas, we made some early decisions and we withdrew our A placement students for the summer placements and our B placement students for the May placements. Really, we made those early decisions, but in fact, Health Education England later stopped those placements anyway. But for ourselves, I think we felt better that we'd made them early, that our students then knew what they were doing regarding accommodation and some of the practical aspects of placement. And we had some plans put in place to retrieve. So for our A placements, we will be using observation of digital delivery next year, some of the interprofessional learning that they've already experienced, and some of the means of shadowing. And for our B placements, well, more complex, I guess, but we will retrieve some of the weeks, obviously, from yourselves in next academic year. But to give those students a grounding, we undertook and planned a 4-week simulation in the university in July. And I will always be grateful for our team for not taking the leave that had been planned at that time and for undertaking that 4-week simulated block. But of course, we also had 2 groups of students who were out with you on placement when COVID hit us in March. That was an undergraduate group who were about to finish their placement and had reached about week 9, and then a postgraduate cohort who were much nearer to the beginning of their placements. Certainly you helped in many ways at this time. Students remained in placement as long as they could until really it became untenable. We made early decisions for our undergraduates in that if they hit the learning outcomes early, then they aligned with an outcomes-based placement and finished at 9, 10 or 11 weeks. We did the same for our postgraduates, but of course they weren't quite as far on into placement, and we had more negotiation to do with those students as they returned to the university. Each was provided with a personalised plan of whether they would undergo further simulation, or they would need another repeat placement at a later date, or in fact whether they'd met all of the learning outcomes and wouldn't need any further placement experience. And of course, some of those students who had passed placement as well then moved on to the temporary register, working in trusts around the UK and primarily outside of Yorkshire, because it was really to do with where they lived at that time point. I think we can safely say that we considered this our most challenging aspect of COVID. Understanding in May that we couldn't send out our students onto B placement and that we would need to develop a simulated B practice placement at pace. We did that. We had experienced practitioners within the team, and Lindsay, as course director, coordinated the whole experience for students. But certainly it happened very late in the day, although we felt that we delivered well in the end. The simulated placement really was collaborative. You provided us as trainers with 30 very detailed clinical cases, so not case studies as such, but true case notes that we could use and allocate to our students. Our final year students worked with us to act as portfolio supervisors, so they were absolutely superb in that role, and they worked to guide the students in collating their learning outcomes. And then service users enacted scenarios for us, which we were able to video and to look at the communication skills techniques in detail. It was underpinned as well by our existing placement documentation, so that was there for us already, obviously, and we signed our students off, or not, as the case may be, but I think all of our students were able to move through, and we signed off at the 4-week mark. We used a peer learning model, 5 students to each supervisor. That worked extremely well and is a very valuable lesson for learning in practice, I think, as we move forward. And then we divided the 4 weeks into weekly themes. That was the professional practice context, so consent, ethics, MDT practice and care pathways, communication skills, online presentation skills, and team working. So we had a clear structure. And then lastly, well, we wanted to look at how we move forward into next year, what might still be with us and the challenges that we'll still face. At the July Trainer Network conference that we held, 90 of you attended that day to listen to presentations on how we might move forward in terms of student training, provide more online delivery at home, balance timetables and many of the practical aspects of placement provision too. For ourselves, well, we're looking at planning our own risk assessments. The university will operate 2 metre social distancing at least until February. We will therefore be looking to provide all of our course provision online. There will be very minimal contact within the first semester. And then lastly, while life goes on too, we have to think about our provision and who we are negotiating placements with if we want to have viable courses. And so as a team, we secured additional placements this year in the Isle of Man, Manchester, the Priory Group and private providers in digital delivery. So a new thing for us. But we hope that all of that helps to share placement delivery with you all as well. And some of that work and some of the simulated work that we did, which proved to be so successful, formed part of the basis for a Health Education England bid to integrate digital online placement days into all of the placements, and we wait to hear what will happen there. And so to finish, I'd just like to say thank you for listening. For ourselves, we never thought we'd be delivering a fully online course in September this year. We will be. We hope we do it successfully. We've learned a huge amount along the way. We hope it's made us flexible and consider alternatives that we'll use in our teaching as we go forward. I'm sure there'll be many things for us to learn and to take on board. Thank you.